God, if I need to leave my job, you know, because it was a really good job. He said, God, if I need to leave my job, show me in black and white. And that was on a Saturday? That was on a Saturday. I think we left on that Sunday. And on that Monday, you got your black and white paper said, time for you to leave your job. Right.
We good over here.
We good over here.
So he couldn't have told me better.
He told you
black
better.
And white.
So it was a blessing, you know. You know, the one thing about us is we pretty faithful people, and we never even had a concern.
Right.
I don't even think
because I was like, God, you told me to do this.
In black and white,
in
right.
Black and white.
Right.
So if you told me to do it, you're going to make a way.
So from there, we started to work the plan, you know, and part of the plan was us getting a business manager, you know, getting a business manager. And from there, we found this young 23-year-old who didn't know Jack.
By the name of Sheba.
Sheba Massey.
And Sheba Massey, and it's been off and running from there. And I couldn't, I can actually say, I mean, it's all worked in our favor. That's all I can really say. Yeah, absolutely.
I call Sheba my little angel that God sent me, because without her, we would not be here
No,
today.
we would not be here. Sheba holds it down. She's the glue that makes this work.
Yep.
So,
and then she's always added her faith and her love
right.
and loyalty.
Right.
So Sheba is a big part of why MiBella is MiBella. So,
right.
Sheba, you've been here from the beginning.
Yes.
What have you learned and seen at MiBella, and what makes you continue to come to MiBella and work with this crazy lady named Dr. Mia for the last 14 years?
Oh, wow.
And be as supportive as you are and believe in my dream and stay here. What has made you actually believe in this vision?
So honestly, why I believe in MiBella and why I believe in Dr. Mia and why I believe in my mission and vision for waking up every morning is because you are here to save lives, you are here to just change lives, especially women, but also as we have grown over the years and incorporated men into our practice, is literally changing marriages,
Relationships,
families, relationships, and it has just been a tremendous experience just seeing how people have just developed from just leading a normal, not happy life into this everlasting total wellness that they receive here at MiBella, because the experience that they get. And when we first started, it was all about customer experience, and it has translated into all of that in 14 years.
Right.
So from answering the phones to when they walk in, when they go to the back, when they're getting triaged, it's all about the customer experience. And you can't get it anywhere else. There are a lot of OBGYN practices here, but MiBella just stands out because why we have grown up into this tremendous phenomenal practice is because of the customer experience. You know, and that's how when I was the first business manager / receptionist / whatever I was,
everything, the everything.
I put in everything into that. Everything I did, and that's how we train our employees. And one thing that I've learned from you guys that you did for me, and now we do for our team, is they are our number one customers.
Number one customer.
So we have to treat our team members with dignity, with respect, with honesty. And what that does, it translates into the quality of care that they provide to our patients. So it is all from how we treat our team members, how they treat our patients, and how we're making a change in our community. And it is amazing because I don't just wake up and I'm like, oh, another day at the office. No, it is we're changing lives. We're doing this big thing in the city of Birmingham, and we're expanding. So things are coming all around the United States for us. And I'm just so glad to be a great part and, just being nurtured. And Dr. Mia is my mentor, and Joseph is my mentor now. And it's just been a great journey just growing up with you guys. So I am completely in love with MiBella.
Yes.
And I love my team, and I just love waking up every morning and looking forward to coming to work and taking care of our patients and helping my team members just become the best version of themselves that they can be.
And we love our team too, by the way. Yes, we love our team.
What we are without our team.
No, absolutely not.
Definitely.
Absolutely not. And like she said, our first customer is our team.
Yes.
And you know, as much as we can train them, and much as we can give them, and sometimes just listening to them is you know. But we're family here.
Yeah.
At MiBella. MiBella is a family practice. Started off as a family practice. You know, including Miss Maggie.
Yes,
you know what I'm saying? Miss Maggie.
Y'all remember Miss Maggie? If you
Miss
long
Maggie.
term, put Miss Maggie in the chat.
Right. Right. Put Miss Maggie in the chat if you know what we're talking about.
Everybody misses Miss
Right.
Maggie.
Right. So, but you know, it makes a difference that you focus on your people. You know, focus on your people. Make sure your people is taken care of. And we go. You know, I talked to Sheba about this one time. We, you know, back in the day, when we were kids and we ran the streets and you know we played outside till the light came on, right? You know, you had a corner store, and the old man who used to own the corner store would take care of everybody, and especially his employees. You know, if something happened at home, they didn't have something, he would give them some cash. He would, you know, do something for them, get their car fixed, stuff like that. And that's the mentality that a lot of employers have gone, especially small business employers have gone away from. You know, and here at MiBella, we are not beyond taking care of our people. You know, it makes a difference in what we give to them, and then they give that to our patients and clients and stuff like that.
And
so
everybody wins.
Everybody wins. Everybody wins. You know,
all we do is. I'm just kidding.
You can say all we do is win. Right. You know, so it makes a difference. It's a huge difference.
Okay, so
Thank y'all for
being a big part of MiBella. Of course, I couldn't have done this without Joseph and him believing in my vision and giving up his whole life for me to live my dream every day, to take care of people with dignity and respect and be able to serve all kinds of people regardless of race or regardless of sexual preference, socioeconomic status. We get to serve everybody here at MiBella. We get to change lives. We get to improve health. We get to educate. We get to prevent disease. We get to fix problems. You know what I mean?
Yeah.
so
without having to go to surgery on everybody.
Right, without having to go to surgery, giving people options and educating them so they can make good decisions for themselves and keeping up with the innovative
things that we have out here now.
Everybody doesn't need a hysterectomy anymore.
Right.
Okay, so just let's talk a little bit about how we've expanded and how our patient population has taught us what we need to do to serve them. So we started off with gynecology and weight management.
Yep.
So I got into the gynecology because I'm a gynecologist, and I've always believed in preventive health and women's health, and that has expanded over to men now. And then we got into the weight management to start as well, because we realized that a big problem with our health and why there's such a huge health disparity has a lot to do with obesity and being overweight. So my goal was to be able to teach my patients how to live a healthy lifestyle so that they can decrease their health risk, live longer, healthier, better lives by just simply maintaining a healthy weight.
Healthy weight,
Cuts out so many diseases.
And being educated about what a healthy weight is.
And what healthy food is and what healthy exercise is and how to prevent stress, like all the things. So we get to do all that here, but since then we've added some other things on. So I think the one in our practice, and y'all tell me what you think, the thing that's made one of the biggest differences in the many lives of our patients, especially midlife journey,
hormone replacement therapy.
Y'all, it has changed the lives of us.
Like if we took everything out of this practice, it would not be hormone replacement therapy.
No, nothing. That cannot come out.
I actually remember the day when we made that decision that we were going to incorporate that into what we were doing, and it wasn't an easy decision because we had to go through like insurance, cash services. But what we believed in after Dr. Mia did her research with the company that we were working with is, hey, this is truly life-changing treatment for the patients, so why not offer it?
And I went and got my first pill when I went to training.
Exactly.
Like I didn't even know that I was crazy and that I had a problem and that the life I was living was terrible. Like I was waking up all the time. I didn't realize that is an issue. I was tired. I was irritable. I didn't want to have sex. I couldn't focus and remember. I was gaining weight. My back was hurting. My joints were hurting. I was emotionally eating, all the things. So they were like, well, just bring your little, labs with you. And if you qualify, we'll give you your pellets. That way you can explain it to your patients. So my labs did qualify. I had like less than 10 of testosterone or 10. And I got my first pellet. And it just changed my life. Like I felt better. I had more energy. I could sleep. My sex drive was good. I could enjoy intimacy, like back to the level that we did when we first started dating and living in sin.
Oh, wow. You said all that, right?
I could focus and remember, you know what I mean? And I mean, my whole attitude changed even around the office.
Exactly.
I was able to control my stress better. I could lose weight again. It was just like all the things. So,
and before then, people thought it was normal to live like that, live in misery.
And that's the thing about it is, I mean, just like our telephones, TVs, and everything else, it's technology, right? And you have to increase, or you have to explore what's new and out here. And so 50s, 60s, 70s, 80s, 90s, 2000s, people just start getting old, meant these type of things were going to happen. People thought if you're on menopause, if you're going through menopause, you're going to have these symptoms, and everybody's going to hate you in the process.
Right. But just live
There's
that
nothing
way.
you can just live that way. You can be uncomfortable for however long that you're in that you're in menopause for, right? So but people thought that, you know, and that's the difference that hormone replacement therapy makes. Just knowing that there is an option for you to fight those symptoms.
And to just treat the problem. The problem is you have low testosterone. So you have those symptoms. We give you healthy testosterone that protects your heart, protects your bones, decreases your risk of breast and prostate cancer. You know, all the things. So why would you not replace your testosterone when you're going to feel that much better and have that much of a quality of life? So that was my most exciting, you know, expansion, I think.
Absolutely.
I think that's one of the big services.
And the other thing about it too, it fits what we do. We're not doing anything outside the scope of our work.
That's right.
You know, it fits what we do. It fits our clientele.
That's right.
So it was perfect for what we do.
Yep. And then let's see, finally, before I bring up my girls, the other providers. Before I do that, I guess my last thing is, so what do y'all see from MiBella in the next 3 to 5 years? Like, are y'all excited for what's to come? Are you pleased at where we've come so far? And what do you want to say to the people?
You want to go first, Sheba?
So definitely we have something else coming, because we are never just okay with being comfortable, right? So we are definitely looking for better options, alternative options, other options to make sure that we can provide total wellness for our patients, right? So obviously in the realms of what we already do, that's best for our patients. So we don't know what's coming, but we're always learning, we're always exploring, we're always training. That's, you guys don't know that, but behind the scenes, MiBella literally closes the doors for training. We train a lot with our staff, Dr. Mia, Joseph, myself. We go on other trainings, conferences. So we're always trying to figure out what is out there that is best for our patients, what is something else that we can do, that we can incorporate into the practice. So yes, I'm so excited to just believing in what's coming next. That is gonna just help our patients, help our staff, help us just be better human beings. So we don't know what's coming next, but something is definitely coming next. So I'm just excited. 2025 is going to be another amazing year. And just be on the lookout for everything else that's coming our way. We don't know what yet, but we are ready for it. So
I would say, you know, there's two parts of our business. So we clinically, we take care of people, but we are running a business, you know, and so that being said, you know, we are looking to expand the business, take care of more people, not just in the Birmingham market, but in markets across the country. And I think 2025 will be our year to move into other markets that we're probably uncomfortable with, which if it's easy to do, then you probably shouldn't be doing it anyway, right? So, but you're probably uncomfortable with, moving to these markets, and some of these markets are heavy markets that we want to move into. But it's a process.
Okay.
You know, it's a process, and we're always learning about how to improve the business, which helps us improve our staff, which helps us improve, you know, the business as a whole, even clinically. You know, so, and we've made a lot of changes this year, you know, improving the business. Some of the stuff we just so happen to come upon, like, this is not working.
Right.
We need to change this, you know, even down to our telephones. You know, we was sending people through the stuff we hate.
Exactly.
So we changed that. So, you know, it's just being able to listen to people
Yes.
and make those changes, and also being able to be taught.
Right.
Yeah.
You know,
Yeah.
A lot of business owners, you can't tell them nothing
Exactly.
until
We
they
listen-
about to
Be coachable.
Be coachable. Yeah,
we
be
listen
coachable.
to our patients. So I
Yes.
have patients who have been coming here for years, and if they have any kind of negative experience for whatever reason, they know how to reach to me directly.
Right.
And we listen to them. And if they complain about, hey, I have the phones, so then we, on the back end, we figure it out.
Yeah,
'Cause we
figure
want
it out,
them-
right.
We want them to have the best experience,
Experience,
not just
right.
clinically, but
But-
overall.
Yeah,
Overall,
You know?
totally.
right.
So we listen
So
to
yeah,
everyone.
I'm excited. I'm
Yeah.
excited. I think 2025, 2026, it's gonna be phenomenal years for us. I think from the vision that you've given, moving into the markets that we really know we can make a difference in, that is gonna work for the people in that area. One of the markets, I don't like, but we're gonna try it out. But we're gonna do it anyway. And then the opportunity for people to get more involved with their own health.
Right.
We're gonna in 2025. Well, this year we're gonna be exposing people to get involved with your health.
Right.
We're moving into technology, y'all.
Yeah.
We're gonna try some technology out this year and early next year and see how it works. And we're not gonna get rid of it. We're just gonna improve on it. So,
Yes.
so I'm excited.
So thank you, Sheba and Joseph, for being a big part of